They show trembling. Sometimes they are rigid, unable to walk. In some advanced cases, they will have some emotional issues too. If you are searching one of them, they are innocent.
Parkinson's disease is a neurodegenerative disorder affecting the motor system and is characterized by extensive and progressive loss of dopaminergic neurons in substantia nigra. Hello everyone, once again, Group P3 of batch 2021-22 is here to tell you more of what you need to know about Parkinson's disease. Parkinson's was first described by James Parkinson in his work, An Essay on the Shaking Palsy. Since then, we have had many discoveries and advancements on this disease. This poster is a basic summary of Parkinson's disease, also referred to as PD. As future doctors, it is important to know how exactly PD affects the cells so that we can formulate therapeutic strategies accordingly. The course of Parkinson's disease cannot be altered by treatment. We can only aim at improving the symptoms and thus improving the quality of life. So why exactly is it so important to study Parkinson's? This brings us to the prevalence of Parkinson's disease. As the global population ages, the incidence of Parkinson's is expected to dramatically increase up to twice in the next 2 decades. As of now, Parkinson's disease is the second most common neurodegenerative disorder affecting up to 10 million people worldwide, most of them ranging from 60 years and above.
Symptoms of Parkinson's disease can be classified as motor symptoms and non-motor symptoms. The clinical aspects of the disease are as follows. The earliest sign of onset is asymmetrical resting tremor in the upper extremity. Over time, symptoms like bradykinesia, rigidity, and gait difficulty appear. Axial posture becomes progressively flexed and stride becomes shorter. Some non-motor signs precede motor signs such as substantial reduction in olfactory function, rapid eye movement, and behavioral disorder. Individuals exhibit kicking motion during REM sleep. Classic signs of Parkinsonism are masked face, shuffling gait, pin rolling movement, resting tremor, stooped posture.
There is no specific test for diagnosing Parkinson's disease. However, a specific single photon emission CT scan called dopamine transporter scan or DAT can be useful in supporting the suspicion. Blood tests can be conducted to rule out other conditions. Imaging tests such as MRI, ultrasound of brain, and PET scans can be used to rule out other disorders as well. The exact etiology of Parkinson's disease remains unclear. However, there has been growing interest in various theories which link to the pathogenesis of the same. Etiologies of Parkinson's disease can be classified as primary and secondary etiologies. Under primary etiologies, we have environmental factors which include chemicals, toxins, and head trauma. Chemicals such as pesticides and herbicides cause mitochondrial dysfunction and oxidative stress, which can lead to the pathogenesis of Parkinson's. Genetic factors also contribute to the pathogenesis of Parkinson's disease. About 15% of people with PD have family history of the condition, and family-linked cases result from genetic mutations in a group of genes LRRK2, PARK2, PARK7, PINK1 or SNCA gene. And the secondary etiologies, drug-induced Parkinsonism, MPTP toxicity, and paraneoplastic syndromes have gained a lot of popularity in the recent years. All potential antipsychotics like chlorpromazine and haloperidol have the potential to cause drug-induced Parkinsonism. There is a toxin known as MPTP toxin, which causes a disorder which resembles Parkinson's. This is due to the selective vulnerability of the nigrostriatal dopaminergic neurons to MPTP toxins. Under paraneoplastic syndromes, tumor entities such as meningiomas, gliomas, CNS lymphomas, and craniopharyngiomas have been associated to Parkinsonism-like symptoms. And surgical removal of these tumors has marked improvement in reversal of Parkinson's symptoms. The mentioned etiologies cause loss of dopaminergic neurons in substantia nigra.
Inflammation has been recently identified as a contributor to aggravate PD. Inflammasomes, a group of intracellular protein complexes, play a vital role in response to infection. Demarcating Parkinson's disease can be tricky at times, as its signs and symptoms overlap to some extent with several other disorders. These disorders are classified under Parkinson's plus syndrome. Dementia with Lewy body has features like dementia, cognitive fluctuations, and hallucinations which overlap with clinical Parkinsonism. Multiple system atrophy, formerly known as Shy-Drager syndrome, shares symptoms with PD such as bradykinesia, rigid muscles, and poor balance. On the other hand, we have progressive supranuclear palsy and corticobasal syndrome. PSP has a distinct presentation than PD. Patients with PSP have a different posture to classically stooped PD patients. They are upright, occasionally with rectocolus. CBS is also clinically and pathogenically heterogeneous to Parkinson's.
Coming to the treatment of Parkinson's disease, as we already know, the course of the disease cannot be altered. Thus, the aim of treatment is to improve quality of life. In mild disease, treatment includes anticholinergics and Seligilin. Anticholinergics help to restore the balance between cholinergic and dopaminergic activity. Standard therapy involves levodopa and peripheral decarboxylase inhibitor such as carbidopa. During exacerbations, which is worsening of the disease, the treatment includes levodopa and amantadine. You must be wondering how these drugs are helping to improve the symptoms of the disease. Coming to levodopa, it acts by being converted to dopamine in the brain. Dopamine on its own cannot cross the blood-brain barrier, thus levodopa is used instead. However, levodopa has several side effects such as nausea and vomiting, postural hypotension, cardiac arrhythmias, and it also exhibits on-off effect after several years of use. Thus, it is only reserved for later stages of the disease. Coming to carbidopa, it is a peripheral decarboxylase inhibitor which prevents levodopa from breaking down before it reaches the site of action in the brain. Seligilin is a MAOP inhibitor which prevents conversion of dopamine to DOPAC. COMT inhibitors prevent conversion of dopamine to 3-MT. A continuous effort has been made to reduce the numerous side effects of these standard drugs. This brings us to new drug discoveries in the treatment of Parkinson's. Alpha-synuclein is a recently discovered biomarker in Parkinson's. Use of monoclonal antibodies against it can help in early prevention of the disease. Opicapone is a third-generation reversible COMT inhibitor, which is less cytotoxic and helps in improving symptoms of bradykinesia and rigidity. However, 18% people experience dyskinesia, among other symptoms. IPX203 is an extended-release oral formulation of carbidopa and levodopa. The idea of using an extended-release formulation is that levodopa and carbidopa can stay longer in the body. Thus, less frequent doses will be required, reducing the side effects. However, IPX203 has its own side effects such as dyskinesia, UTIs, falls, nausea, and dry mouth. We have come a long way from treating motor symptoms and establishing clinical assessment to treating both motor and non-motor symptoms while using technology-based methods. We are now looking at precision medicine for multimodal assessment and individualistic treatment of Parkinson's disease. This is one among many future treatments such as stem cell therapy and gene therapy. There is a long way to go. But let's work and hope for the day when many more people living with Parkinson's disease lead better lives. For more information on Parkinson's disease, you can use these references which we used in this video. Before going, I would like to thank our mentors, Kartika ma'am, Bharti ma'am, and Padma ma'am for their wonderful guidance during this project. And of course, all the members of Team B3 for making this a success. So, thanks for watching and see you next year.